Welcome to the Interprofessional Space podcast, where the spirit of inquiry meets healthcare collaboration. In our podcast, we discuss all things interprofessional education. According to the World Health Organization, interprofessional education, or IPE, is when students from at least two healthcare professions learn about, from, and with each other to improve health outcomes and enable effective collaboration. Welcome back to part 2 of our conversation with Dr. Tina Gunaldo. In this episode, we'll be talking more about interprofessional education and discussing the organization Collaborate for Health, as well as the American Interprofessional Healthcare Collaborative and more. Let's jump right in. One of the things that I wanted to talk about or wanted to ask you about, Tina, was Collaborate for Health. That is your, brainchild, the organization that you created and that you're heading. I've looked at the website, which is really great. I would love for you to just tell us about it. What started that? Because that's a big undertaking to just wake up one day and say, I think I need to create this organization. Can you tell us a little bit about how you got to that point and then what you offer or what you bring in that organization?
Thank you. Okay, so it is somewhat fuzzy because I remember thinking about this during the pandemic, but I don't think it came to fruition during the pandemic. But as time goes on and we all evolve professionally and we develop ourselves, I knew probably, I would say, at least 3 years ago that I wanted to make an impact in regards to interprofessional work that was larger than just one institution. And even though I had the pleasure of exposing 1,500 students on an annual basis to interprofessional education, and I thought that was great, something was missing. And there's two things missing. One is that even though you influence the students or the learners, and those learners will have their hands-on time with patients, and so you are basically supporting, right, the care that these students will be providing. And so that's really great. And to know that if I had the opportunity to influence them so they became more collaborative in some way. When they started practicing, they're going to touch multiple patients, right? But it was still 1,500 students. And where we need to go in healthcare, 1,500 students is great, but it's really not enough. And then the second thing is that in education, I had spent some time there, but because I'm a physical therapist by training, because I stopped practicing probably about 8 years ago, I was no longer in front of patients. And so a part of Collaborate for Health too was thinking about, well, who's the most important person on the team? And of course, it's the patient or the family or the carer. And so wanting to get one step closer to them. And so Collaborate for Health is simply what it means is that we need to collaborate for better health. Um, and that could be prevention, that could be secondary prevention, that could be tertiary care. But regardless of where the patient is on their journey, we can definitely collaborate better within the healthcare industry and external to the healthcare industry to support overall health. And so that's the concept of Collaborate for Health. Now I work full time. I worked full time in education. I work full time now. And so sometimes in developing an organization, you have to find time to do that in your spare time. And so it is coming along. But what I want for Health to be is an organization where eventually I don't want to do it alone, right? So one of the things I continuously struggle with is that how can I have an organization or a business that has a siloed partner, which is me? It doesn't feel right. Every day that I work on it, I say, I need additional partners to join me in what we do. And so one, it's just advocating. And so I'm on my journey right now is about advocating for interprofessional practice or interprofessional education, giving time to that. But now also as well is I'm trying to develop items, products, whatever you want to call it, such as the guide, the 30 characteristics for high performing teams. It's free, it's out there for anyone to use, but eventually would I want to coach on that? Would I want to consult on that? Absolutely. Would I want to create some coursework out of that? Absolutely. And so I am working towards that as my time allows. And so developing a website, talking about it on LinkedIn, those are my two main areas of getting the word out. And I've been really supported by our interprofessional education community by being asked to come and speak at conferences. I think that's the main thing, or actually helping to coach some people individually. And so that's Collaborate for Health, though, is out there to be a centralized area for whoever wants it to be a centralized area to help support the health team. And that includes patients, providers, health professionals, and non-health professionals. I hope that was helpful.
Absolutely.
I think coming off of that for me, I think you you're very generous. Like if anybody follows you online, which I think they should, especially on LinkedIn, because you're great at what your posts and everything. You're very prolific at that.
So I have to say it is a priority, right? It's what's your purpose and what's your why. And um, when I um, when I was in my transition period from education to practice, I really had to dig deep and I had to say, what was my purpose? What was my why? And really, it went back to serving the patient through a collaborative approach. I mean, it's as simple as that. And however I can do that, I'm no longer touching the patient in terms of practice. So I can't impact it that way. So if the way that I can impact it is working, in a full-time job, but then also online through social media, I'm going to do it that way. And so I would have to say it has to be a priority for you, right? And what you want. And so one is that I've tried it all, trying to put, okay, so let me step back. I am not on, you might find me on Instagram, but I'm not on Instagram. I'm not on TikTok. I'm not on Twitter. I even stepped away from Facebook for a while personally because I was putting more time into LinkedIn. And so if you were to ask me where do I spend every day, probably, some not every day, but literally I would say probably 90% of my time on social media, it is on LinkedIn. So I've concentrated in one area. Um, I wanted to go more into Facebook from a patient centric perspective because I think that's more where our patients and our caregivers are. But I don't have the time for that right now. So kind of going back to your point, Susie, like how do you include it all in your day? And so you have to. And so I've tried 7 days a week. That's very hard. I have now turned it back to 5 days a week. And then some days, if I feel like I just can't post, I just can't post. I'm not going to force myself. But everything that I write about, I feel like is a part of my journey now. So just like Ann had said, I had documented or posted something about the food pantry is now open. Super excited about that. Um, Today, I'm working actually with Eva from the Switzerland, and we're going to be offering a class on the power of agile and interprofessional teams and bringing them together. And that's going to be really amazing for those of us who are interprofessional experts. The agile world can bring some structure into what we do, and for those of our audience that are agile learners and experts, having more of those behavioral competencies, compassion. I kind of talk about the real person skills that's going to help agile teams have better high performing teams in their work. And so that post today is about what we're doing and what we're learning together, Eva and I, because I don't know about agile teams, well, I'm learning, and she didn't know a lot about interprofessional teams in terms of a healthcare. So that post today was about what we're learning together. And so every post is about learning what's real. Sometimes it's just a question in my head. And I asked it the other day. We always talk about a hierarchy. I say I asked it the other day, probably asked it weeks ago. But I noticed it here in the health system where I was, and not in a bad way. It's just I noticed some things and I thought, are there hierarchies in healthcare? Like, what do you think? Right? We have to talk about these things. We're not pointing fingers, we're not placing a blame, but is there a hierarchy in healthcare where you work? And that could be in a healthcare setting, that could be in healthcare education, that could be in a nonprofit community organization. But where do you have healthcare or health professionals? Is there a hierarchy? And let's talk about that, right? So, being on social media is very much intentional for me. It's very much strategic for me. Um, it's where I choose to spend my time in terms of following my purpose and why, and how can I get more people to buy in or be motivated to practice in a more collaborative way. And that's really my why. I really want to impact more people than what I have within the organization where I formerly work. And that's really for the benefit of the patient. So, I mean, the result is hopefully patients are receiving better care, and they have better health outcomes.
Yeah. Absolutely.
Right. Absolutely. So I'm, as I'm thinking about this discussion, which I'm very much enjoying, I'm hearing you say repeatedly that it's about what the patient receives, and that is important. But I'm also hearing you talk about things at a level that's visionary, really, with the things that you spend your time on and your energy on. I want to bring up something that I'm involved in as well. Certainly not at the level you're at, but I want to ask you to talk a little bit about the American Interprofessional Health Collaborative, because you are a co-convener.
Yes.
And what I know about you just from this discussion, frankly, is that means you're passionate about the work that's happening there. So could you talk a little bit about that, please?
Yes, so I will, and thank you for asking about that. And so the American Interprofessional Health Collaborative is our national organization for anyone. So patients, healthcare providers, teachers, um, educators, practitioners to come together to have these discussions on how to elevate our interprofessional, I'm just going to say lens, because our practice, everyone interprets their practice a little bit differently, right? And so, how can we elevate that lens? And so, what I love about AIHC is that we have developed an organizational structural model that truly embraces collaboration at its finest. And so when you think about Devin and I as being co-conveners, which might be similar to a co-president role, Devin and I do not have meetings outside of our monthly hub meetings. And our hub meetings are made up of our leaders of each of our 4 collaboratives and our 2 committees. And so it is not a hierarchical structure. If we're having discussions, we're having them together. Now, time, right? Speediness. You have to think about that, because if you're only meeting once a month, how much work can you get done within a certain period of time? And so just thinking about AIHC bringing together educators, bringing together students. Our goal is to help to be more, and we are inclusive, we're welcoming, of course, but being able to draw attention for practitioners to join AIHC is really something we would like to do as well. And so if we truly could have a balanced mix of practitioners, professionals, students, and educators, that could really help us advance interprofessional work in the United States much more rapidly than the pace that it's occurring now. Is that good, or did you want any more additional information? Okay.
That was great. And yeah, I'm thinking of, frankly, of Angela Cecil. If I didn't give you an opportunity to talk about it, I'm sure I would hear from her saying, "Anne, you are on the membership committee. Where was the discussion?" So
I'm sure she would too.
Yeah, she would be very lovely about
Angela.
it, but she'd call me out. Yeah,
yes,
absolutely.
Yes.
So, and just to clarify, so AIHC, because we are international, that is specifically for Americans working in America healthcare system.
Yes.
And can they just go to the website and join? Is that free for students, or sorry, I shouldn't be
There is
saying that.
there is a fee in terms of a membership fee on an annual basis for everyone, except for patients and carers and families. There's no charge to be a member if you're serving in that role. But for everyone else, there is a membership type of fee. And it has to be in the US, because internationally, most regions have their own network, right? So we're all members of interprofessional.global. And so your regional network is going to be where you work and where you live. And you'll join that particular network. But collectively, we come together and work collaboratively through interprofessional.global.
Great. Yeah. And that's how I do through CAPE. So in the UK.
Yes.
So we've got a similar, so that's a similar organization in what we do. That's great.
So, Tina, I don't know if you've ever watched Inside the Actor's Studio, but some of these questions are from and also inspired by the questions that are used on that show. So it'll be a little bit of a rapid fire, quick question and answer, and I'll go ahead and start us off. What is one thing about your own healthcare profession that you wish other team members knew?
My goodness, it's plentiful. I think, I don't know if there's absolutely one thing. I think for any health profession, including physical therapy, which is my own profession, is that please know that the more education that we all receive and the more we all advance our practice, we're not just responsible to be a general practitioner anymore, but there's various areas, cardiopulmonary, wound care, orthopedics, neurological, geriatrics. I could go on and on, but there's so many facets of every profession that we all need to take the time to learn about, especially when our patients need that particular service.
All right, so here's mine. Do you have a favorite medical word? And what is it?
What is my favorite medical word? I'm just going to say interprofessional. I love it.
That's a great answer. What is a profession other than your own that you would like to attempt?
Okay, so I'll be very open and transparent and vulnerable and all of that good stuff. And so I don't know why. I really don't know why, but I've always wanted to become a bartender. So maybe you'll see me do that once I retire.
Oh,
Fun. Yeah.
love it.
Good. Um, and then so one of my favorites. So what is a book that you're currently reading or one you'd recommend?
Okay, so once again, I'll be truthful and honest. I spend most of my time reading articles, research articles, and I spend most of my time reading social media articles or blogs or posts. But one of the books, it's not a management book, it's not a healthcare book, but it's a book about those who have been imprisoned. And so Solitary is a great book. I can't even finish it right now because the stories within it are so emotional. And so taking it piece by piece, learning how to be more compassionate to those who have had unfortunate circumstances, and trying to understand the world that they have lived in, has been a great area of personal growth for me. So compassion wise, empathy wise, unfortunately, people do are imprisoned. And that is, there's nothing we might be able to change about that, but we can definitely change our attitudes about the way we interact with individuals who have had that in their past or in their present.
Great recommendation. Thank you.
Mhm.
So I think we have time for one more. What is a sound or a noise that you love?
Oh, I know this is easy. I love to sit on the front porch in a rocking chair and listen to the birds chirping. No better sound.
Yeah, that's great. I
Yep.
can imagine it now.
Like,
Yeah.
like,
Yeah.
so, is there anything else you want to share with us? We are literally running out of time. But
I think the biggest thing that I want to share with everyone is to, I'm on LinkedIn to share information. I would love to learn from others. So the more of us that contribute about what we're learning from an interprofessional perspective, the better. The more individuals get exposed to that information. It's not about if your information is right or wrong. Because it's not wrong to share information, but it's about wanting to share it, and you'll be amazed how the little things about when I share things about interprofessional work, it's about the spelling where I get the most attention. And so something as simple, should it require a hyphen or does it have a hyphen or not, right? It doesn't. But I get the most engagement on the most simplistic things. And so exposing everyone to interprofessional work and what we do is so important. And so don't approach social media, especially on LinkedIn, in regards to you have to be an expert or you have to feel really confident in what you're posting. Just post what you know and you do every day. And then that way there'll be more of right, this snowball effect of getting everyone on board to really what it is and what we're all doing.
right. I think that's really something to take away for sure. Because I know I always get in a muddle and I'll think, oh, should I post that? Oh, wait, is that worded right? Oh no, I don't know. Then you just abandon it.
That's right.
So, yeah.
Great tip.
Thank you so much, Tina. I think we just really want to thank you for coming and doing this interview with us, and we really appreciate you giving your time up for it.
Oh, thank you. I appreciate you asking. I think this is great that y'all are doing a podcast on interprofessional work. I think it's wonderful.
So I want to echo that. Thank you. It's been a joy. Before we sign off, we want to remind you that whether you're a student, a practitioner, or an educator, the work that you do is important and it can be really stressful, but you are not alone. So please take care of yourself. Let's take care of each other, and we hope you can join us again soon.
Thank you for joining us for part 2 of our conversation with Dr. Tina Gunaldo. Ann and I had a wonderful time talking with her, and we hope you enjoyed it too. If you missed part 1, you can find it in our episode list. And if you want to get in touch with Tina, you can find her contact information in the show notes.